So
Okay.
now we're talking about regulation,
Yeah.
and now we're going into resilience, because now this is the essence of what would have taken an albuterol to cope with it. Because I also want to just have a caveat here in the sense that TBM, NET, EMDR, NLP, Chinese medicine, five element theory, Ayurvedic medicine, the chakras, all these different aspects of psychoneuroimmunology and epigenetics are all part of the lifeline technique. So it's infused. All that went on in are part of the lifeline. Here you are, and now there's a resilience. And so what I'm curious is if you wouldn't mind sharing, like you go back and forth in doing different things clinically as a doctor with your patients. What kind of experiences or feedback or outcomes are you getting as a result of utilizing the lifeline technique within your practice? What kind of resiliency are you seeing occur when you're able to create a regulation from a subconscious perspective as a result of this technology?
I'm having a flood of memories of clients who've had profound shifts, profound states of gratitude, like I did with you and you working with me at that time. I'm first one that came to my mind is of a person who we were doing a trauma processing of a memory in which the only aspect of the memory this person had access to was this locked feeling in her throat that she felt like she couldn't actually breathe out of the right side, just the right side. So when we started with EMDR, she did have the abreaction, the overwhelming emotional state that was so strong that her whole body went into like a convulsive state. Tears came, eyes, pupils dilated, and in a state of tremendous overwhelm. I immediately shifted to Lifeline, and she quickly re-regulated, and she then was able to talk for the next couple days about how she now feels that she has the courage and has access to a narrative about what this represented. So part of the resiliency was not only the calming and quieting that Lifeline created, but then access to language that helped to soothe and calm her even more.
Hmm. Yeah,
So
yeah.
yeah,
Yeah, it is. That's an awesome story, because oftentimes, and I know other people that are listening can relate of being in a situation where we get triggered, and we get triggered all the time, sometimes a little bit, sometimes a lot of it. And in that state, we lose our voice, we lose our ability to communicate, because that memory that it represents perpetuates a certain personality, a certain behavior, a certain biology, where we truly lose the ability to communicate. So having that ability is definitely a beginning step of detoxifying the mind, so that we can begin to step into joy and fulfillment and confidence within ourselves. You know, those people that this has inspired a curiosity in, definitely click on the link, check out what's going on November 1st. You don't want to miss it. If it's something that resonates with you, you'll be grateful that you did. And if not, when the timing's right, if ever, then that's beautiful as well.